Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts, we've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. All right, well, we're going to get our show going here. So, welcome everyone, and thanks for joining us. This presentation is going to be on Movember. What's Movember? Well, Movember. Today, we'll dive into the significance of Movember and raising the awareness about men's health issues, including prostate cancer, prostate obstruction, and recommends screening test. By the end, you'll have a clearer understanding of how these conditions can affect men's lives and what can be done to improve detection and treatment. So Movember is more than just a fun tradition for growing mustaches, although there's always a good reason for a mustache. It's a global movement dedicated to tackling men's health issues. Since its inception, Movember has raised millions of dollars to fund projects related to mental health, prostate cancer, and testicular cancer. Today, we'll focus on its impact on men's physical health, specifically prostate-related issues. Well, we know men, they often delay seeking medical help, which can lead to higher rates of preventable disease and death. Prostate cancer is a major issue. It affects 1 out of 8 men in their lifetime. These statistics emphasize why raising awareness and improving health behavior in men is critical. So what is the prostate? It's a small gland that plays a large role in men's reproductive health. It produces the seminal fluid that nourishes and transports sperm. As men age, though, the prostate can enlarge, which can lead to various health issues. Understanding the prostate's function helps us see why it's so important to monitor for any changes as men grow older. There are 3 main issues men may face with their prostate. Those are BPH, which is called benign prostatic hyperplasia, and prostatitis, which is an infection of the prostate or inflammation of the prostate, and prostate cancer. Of course, that's the one that we're worried about the most. So prostate problems often present themselves through urinary symptoms. Men may notice trouble starting or stopping their stream, frequent urination, especially at night, and even pain. If left unchecked, these symptoms can indicate a more serious underlying condition. So prostate obstruction, or that BPH, is a common problem as men age. As the prostate enlarges, it compresses the urethra, making urination difficult. In severe cases, untreated BPH can lead to bladder or kidney issues. Fortunately, treatments range from medications to surgery, and early diagnosis is key. And that's one of the big changes. A lot of patients are worried about, going through procedures to have their prostates, because they remember the old, we used to call the Roto-Rooter, the TERP of the prostate. And nowadays, we're doing more of these, what we call minimally invasive procedures to treat the prostate. And as we talked about some of those in earlier shows, those are much easier to go through, have really good quality effects. And, of course, taking medications works, but it's more of a Band-Aid. I think that if you have the problem, it's best to treat it. Now, prostate cancer, however, is the second leading cause of cancer-related deaths among men, but it's also a slow-growing cancer in most cases. Many men may not even know they have cancer until it's detected through screening. Like most cancers, early detection is crucial. We'll cover the screening recommendations that are recommended. So certain factors can increase a man's risk of developing prostate cancer. Age is a significant factor, with men over 50 at the highest risk. Also, if there's a family history, it plays in a definite role. Not that it's inherited disease, but if you have a brother that's had prostate cancer, that may indicate you're higher risk, or a father. As does race, with African American men having the highest incidence of prostate cancer. Now, diet and lifestyle can contribute too. Men who consume high-fat diets or are obese may be more likely to develop the disease. There are 2 main screening tests for prostate cancer: the digital rectal exam and the prostate-specific antigen test, the blood test. It's recommended that men begin discussing these screening options with their healthcare providers around the age of 50 or earlier, again, if they have any of those risks. Now, the PSA is a simple blood test. It's used to measure the level of prostate specific antigen in a man's blood. Elevated levels of PSA can be a sign of prostate cancer, but they can also indicate other conditions such as enlarged prostates or infections of the prostate. So, this test is one of the most important tools for early detections for prostate cancer. And combined with other exams, it helps doctors make informed decisions about further testing or treatment. Now, one of the things that's really changed in my career, and I've known PSA since it first came out, is typically if you had an elevated PSA, you were coming in and having a prostate biopsy done. And we don't no longer do that on a single PSA. We're going to always order a second PSA. You should always have a repeat blood test to be sure, kind of screen for some of those other factors. And now we're even adding some of these other tests when that becomes still positive, is doing some of these what we call biomarkers and things like that that can help to give us a better clue as to what the risk of finding prostate cancer is versus doing a biopsy and getting a negative biopsy. So while PSA tests are useful, elevated levels don't always indicate cancer. So sometimes, as we said, BPH or infections can cause higher readings. So we'll do other things besides a biopsy, but it may be a biopsy that's necessary. But we're doing MRIs to try to diagnose and see if there's a lesion that can be seen on MRI, which may change our opinion. The digital rectal exam is a simple physical exam where doctors insert a gloved finger into the rectum to feel for any irregularities of the prostate, such as lumps or hard areas. While it may be uncomfortable, for some men, it's an important tool in conjunction with the PSA test to screen for prostate cancer. The problem with the digital rectal exam is most of the time, by the time you can feel an actual nodule, that prostate tumor has gotten fairly large. So PSA will detect much smaller tumors. However, PSA is not a perfect test. Sometimes it does miss. There's some prostate cancers that don't generate a lot of PSA. So having the digital rectal exam in conjunction is helpful. I can tell you that there has been a bit of a movement away from using the digital rectal exam because of this increased sensitivity of all these other tests, but still small, quick exam worth doing. So if initial tests such as the PSA or DRE suggest digital rectal exam suggest abnormalities, then a biopsy may be recommended. A biopsy just involves removing small tissue samples. And when I say so small, these are the size of a thread. We use a needle to take the samples out, and the prostate samples are the size of a thread, about a 1-inch thread, so pretty small. From and then these samples are then sent to a pathologist who examines them to see if there's any cancer. The only way to confirm prostate cancer diagnosis is through a pathology study. It'll also tell us whether it's very aggressive or not aggressive. So it'll give us some kind of marker or some levels of what we need to worry about. Early diagnosis through biopsy can significantly improve treatment outcomes. Early caught prostate biopsy has a close to 100% cure, whereas cancers that have advanced, that cure rate drops down to 35%. There are several different options for prostate cancer depending on the stage and aggressiveness of the disease. Active surveillance may be used for low-risk cases where the treatment may not be immediately necessary. For more advanced cases, surgery like removing the entire prostate or radiating the prostate with radiation therapy can be used to target and get rid of the cancer, cure the cancer. Hormone therapy is an option, particularly when prostate cancer is advanced. As it grows, helps to reduce the hormone level that fuel the cancer growth. So lots of options out there. But one of the big things that's changed is a lot of times we can just watch things if it's a very low grade tumor and not do anything except what we call observation, active surveillance. Now, Movember has significant impact on men's health, raising millions for research into prostate cancer, testicular cancer, and mental health. By getting involved, whether through donating, raising awareness, or simply growing the facial hair, you can contribute to this important cause. Encouraging the men in your life to get regular checkups and screening can make a huge difference in catching potential health problems early. So, beyond prostate cancer, Movember also focuses on other critical men's healthcare issues, including mental health, testicular cancer, and overall fitness. These issues are often stigmatized, and Movember works to break down these barriers. Now, we're going to also, during the month of November, cover some of these subjects. I'm going to talk about testicular cancer. I think that's an important one to get out the word on screening for that. Um, Lifestyle and fitness, that's something we often overlook. The simplest thing that you can do, it can prevent heart attack, stroke, and almost all cancers by improving our lifestyle. And I got to tell you, most of us are not living the best lifestyles for what we should be doing. So I'm going to go over some really simple things I think you can do to improve your health. We'll have a talk on that. So unfortunately, mental health is not one of the fields that I'm qualified to talk about, so I'm not going to be discussing that, but know there are professionals out there if you need to talk to them about any kind of mental health disease. It's going around. So you can get involved. There are many ways to get involved with Movember. Again, just start by growing that facial hair to spark conversations. Nothing gets somebody talking about like when you come in, you're looking a little scruffy and they say, "What's going on with that?" And you tell them, "Hey, I'm supporting the Men's Health Initiative." You can start by growing that mustache to spark conversations, donate or fundraise for the cause, and most importantly, encourage the men in your life to prioritize their health by getting regular checkups and screenings. So I hope you found that really helpful. And like I said, we're going to spend Movember discussing men's health. So enjoy that. Last month, I know we did prostate because it was prostate cancer awareness. So we really focused on that. We're going to kind of almost be in that same vein this time. But anyway, join us this next week for more of our Movember topics, talking about what we can do to improve men's health. Thanks for joining us on UroNerd.